Hi, my name is Kyle Botten. I'm a recent Slippery Rock University physical therapy graduate. I graduated in May 2012. I'm currently completing a sports physical therapy residency at Gunderson Lutheran Medical Center in La Crosse, Wisconsin. Yes, a seemingly random place to end up leaving Pittsburgh, Pennsylvania for. At some point during physical therapy school, I decided I wanted to start pursuing a sports physical therapy residency, and actually it was right around this time that Casey came into our class talking about something called postgraduate physical therapy residency and fellowships. I don't know how much Casey's told you about how much time residents put into their job, or what the different components are of a physical therapy resident, but for a sports physical therapy resident, you're usually putting 60 to 80 or more hours a week into your work. You're putting a lot of time into independently carrying half a PT caseload. You're putting time into mentoring with one of the other physical therapy faculty members, putting time into research, spending time in the classroom teaching, spending time most often evenings, especially on Fridays and Saturday nights, providing medical coverage at athletic events, spending time in the athletic training room, putting time into physician observation in the observation hours in the clinic and in surgery. You're spending a ton of time doing all these activities for half a physical therapy salary. So why would anyone do that? Well, my rationale was I wanted that mentoring after PT school for my first year out to help me handle cases that I wasn't really sure about, or to get other physical therapist ideas of how to manage different cases. I wanted to participate in a research project, which I didn't really get experience with in PT school. I wanted to try teaching. I wanted to go into the OR with surgeons and watch my patients have surgery, and then be able to see them for their post-op visits, having watched exactly what they had done to them. I wanted to spend a lot of time with athletic trainers, getting experience and knowledge with caring for athletes on the field and on the court, after they've been injured, and then seeing them in the clinic to treat them, as a physical therapist. And quite frankly, making less than a lot of my other classmates, but up to this point, the most I'd ever made in a year is probably $5,000 or $6,000. So the salary I'm making right now is actually pretty awesome. I wanted to do this right after PT school, while I was still in that academic and workhorse mindset, where I was still used to putting in a lot of time into studying and learning new things and new skills, and while I was still used to not making a lot of money at all, or even any money, and it's a 1 year sacrifice that I know I'm going to be happier in my career after this, and I know my patients are really going to benefit from my year of residency training for years to come. Going into PT school, I kind of had in mind that I wanted to work with the orthopedic and athletic patient population, and during my internships I had the most fun working with that same population. I was an athlete in high school and college, and I was injured a lot, and I was a physical therapy patient, receiving care from a non-specialized PT or generalist and a specialized physical therapist and just the quality of care difference between the two is remarkable. I wanted to better serve my athletic patients with current interventions and get them back to their sports as quickly as possible. Hopefully, in better shape than they were before they were injured, and with less chance for getting injured afterwards. I wanted to sit for the board specialist exam within a couple years after PT school. As of now, I'm going to be able to sit for this when I'm 25 years old. So I think that's pretty cool to have all this training to be able to be a great PT for my athletic patients. At such a young age and so early in my career. Most residency programs are pretty similar in that they offer a lot of the same components within their program, like sports physical therapy residencies. Most of them will have some component of independent patient care with a mentor, some sort of research project, providing athletic venue coverage, spending time in the athletic training room, spending time with physicians in the OR and during their clinical hours. However, each program offers a different emphasis on several of these components. I really liked how Gunderson Lutheran seemed really balanced across all of these. Right now I treat patients 3 afternoons a week for around 5 or 6 hours at a time, so around 20 hours per week. An example week for me is Monday morning. Sometimes we'll have journal clubs with the sports med docs and physicians. It'll be similar to what you'll do in evidence-based practice. You'll sit and talk about different research articles and how you may apply that information into your daily practice. And then Monday morning I'll have additional time to pursue other opportunities available, like spending time with the surgeons in the OR, or spending time with different physical therapists while they're treating patients, or even working on a research project. In the afternoons, I'll have mentoring with the different physical therapy faculty members, sometimes treating their patients, sometimes we're working on treating my patients, and other times we're just discussing patient care. Tuesdays and Thursdays are pretty similar. We'll start off in the morning working at the University of Wisconsin at La Crosse, this campus, working as a lab instructor and assisting with the teaching component there for their musculoskeletal, upper extremity and lower extremity courses. We are required to actually teach a couple of the lectures and lead several of the lab sessions. Actually, last week we were raters for the second year's competency exams for the knee and hip, so it was pretty cool to be on the other side of things, only a year after graduating from PT school. Tuesdays and Thursday afternoons we're treating patients. Wednesday mornings are pretty much open for catching up on notes or spending time with the physicians or other physical therapy faculty members, even working on our research project. Wednesday afternoons I'm spending time in the athletic training room, which is a really different experience than what I'm used to in the clinic. You have 20 athletes come in at 2:30 after school, all needing to be seen and trying to get out to practice by 3 o'clock. So you have a minute or two to do your whole get the subjective, get the objective component in, and come up with a plan for what that athlete can do that day. Again, Thursdays in the classroom, and then treating patients, and then Fridays treating patients, working on research. There's another sports physical therapy resident doing the program with me right now, and a lot of times we'll get together and practice a lot of the things we're learning throughout the course of the year, and then usually Friday nights, spending time on the football field, covering games. The Saturdays, covering, we just started hockey season with one of the local minor league teams this year, so spending a lot of time with them. So that's an example week for me, and it changes throughout the course of the year. Additional things I left out are completing clinical rounds with several of the physical therapy faculty members, learning advanced skills with our evaluation and our interventions, covering upper extremity, lower extremity, and spine throughout the course of the year. I think most physical therapy residents would say what they like most about their residency experience is probably all the opportunities you get that otherwise you probably wouldn't have come across outside of a residency program, as well as the mentoring component of the residency program, which when you're applying for jobs in a couple of years and you're completing that interview process, it'll probably be won't be uncommon to hear that a lot of clinics will offer mentoring to new grads. However, from what I'm hearing from a lot of my classmates is that their employers aren't really doing a good job keeping their promise, and the other physical therapists aren't really spending a lot of time with my classmates, teaching them new things or helping them handle different cases. So, which is understandable because that time isn't really built into their schedule. The other physical therapy faculty members here at the residency actually have that time built into their schedule to talk with us about our patients and their patients and to teach us things. So that's a really great aspect of the residency. The salary is one other thing I really like about the residency. It is paid. It is a lot less than what a lot of my other classmates are making. However, it is nice to receive a paycheck, which I wasn't used to in PT school. One of my favorite things about completing this residency this year is the fact that I only have a limited caseload. My first year out of PT school. Right now I'm working a little less than 20 hours per week treating patients independently, which is great because I get to spend extra time doing a great job with a limited number of patients rather than trying to do a mediocre job managing a large number of patients. Residents would probably say what they like least about completing a residency is the commitment and time you have to put into the program. I think on my program's website they said something about residents being expected to work 40 to 50 hours per week. And I can tell you working 50 hours in 1 week would be amazing because most of the time I'm working upwards of 70 or 80 hours in a week. So that's something, it's a challenge throughout the course of this year to have to be really efficient with my time and have to just get used to not having a lot of free time outside of the residency. Which free time does exist. You just have to be wise with how you use it. Another tough thing about completing residency is being able to match the level of care that's expected of you. Not just providing a entry-level quality of care, but at the end of the year, it's expected that you're practicing as an advanced practitioner. Using current evidence to back the interventions that you're providing with patients, specific to sports physical therapy. You're expected to be able to match